Welcome, everyone. Welcome to the BioInnovation Forum. I want to thank particularly One Business World and colleagues at Fin Partners who have made this session possible. Throughout the day, you'll be hearing from some of the world's great innovators at all different stages of corporate enterprise, from startup to very established companies. You'll be hearing from people who are developing new molecules that can sustain and save lives. And you'll be hearing from people who are developing devices, health information tools. They're applying the possibilities of augmented intelligence, or some people say artificial intelligence, AI, to the problems of health and medicine. You'll hear from people who are really courageous and who are taking ideas, bringing them through the laboratory, through regulatory processes, and most importantly, to patients who need them to sustain their lives. It's a pleasure to be here with you today. I'm Gil Bashe. I'm one of the hosts of the sessions, and I've been invited to kick off the conversation talking about healing the sick care system, why people matter. This is a new book that's now available on Amazon. I'm privileged to be the author. I will say, just as a point of reflection, that the book has already become the #1 book on Amazon new releases in health policy and public health. I am incredibly appreciative to those people who have jumped into the pond, and I think it's because they support why this book exists. It exists actually to support the people who are going to JP Morgan. Those people who are either presenting at the official JP Morgan healthcare conference, or those people who are really at one of the satellite gatherings that have morphed around the JP Morgan gathering, understand that JP Morgan is a community. It's not just a specific conference supported by the organization, the bank, JP Morgan. It's really about celebrating innovation, health innovation. And that's very much what Fin Partners believes in. We are champions of health innovation, and that's one of the reasons, among the reasons, we're proud to partner with One Business World to bring this day together so that people who are not necessarily in San Francisco, they may be in Asia, they may be in the Middle East or Israel, they may be in Europe, they may be in other places in the United States, have the opportunity also to participate during JP Morgan and share with you what they're doing to improve the healthcare system. I've been asked to talk as a kickoff, perhaps a little bit of inspiration about this new book, which I want to first explain why the book exists. It exists for those of you who are listening, for those of you who are in San Francisco, for those of you who are really pursuing opportunities where you're speaking to, whether it's investors or shareholders or corporate partners or clinical leaders, to pursue your innovation, your idea that can sustain and save lives, to improve the human condition. The book is dedicated to all of you, I might add. And you are the reason why I toiled over the last 9 months writing diligently so that this book would come to life on February 1st, 2026. The book has the vantage point of 4 decades inside the health and life science ecosystem as a provider, as a combat medic in an elite military unit, as an industry lobbyist, as someone who created a startup enterprise. And I was privileged to evolve into a group company CEO in a large holding company called WPP Group, championing their health work around the world. Then off to a large private equity group, GTCR Goldner Radner, which today is a $10 billion firm in active management. And then to do a series of turnarounds. And then I'm privileged now to be chair of Global Health and Purpose at Fin Partners. There's a difference between a system that treats illness and one that supports healing. And this is not a critique, but it's a call to reconnect purpose with practice. For those of you who are in the innovation field, you're passionate about creating. The challenge isn't about your creation, your innovation, invention essence. You're inventing. The challenge is actually with the ecosystem that can embrace or impede what you're doing. And it's not intentional to create obstacles in your path. The ecosystem is built of a myriad of players, and they're not always working in harmony. They're not collaborating. And so the book, in essence, deals with that tension of the life science leaders they have to live with. It's about innovation, it's about speed, it's about capital, it's about regulation versus lived human experience. It's the pressure to deliver outcomes while preserving trust. It's about recognizing that the most misalignment is systematic. It's not personal. So if you're meeting challenges with whether it's an investor or a regulator, or someone you thought could help you in a hospital system pilot your efforts. Nobody intends to put obstacles in your way. The system itself is built around obstacles. Even the people in the system are suffering from the obstacles. The book also has a different aspect to it, which is people matter as a design principle. The challenge is that our health system, particularly in the United States, which is the world's single largest market, is very complex. The pieces don't speak to each other, and you may have an incredible idea that you want to bring into practice, but unfortunately, it doesn't get traction. And it's not because it's not valuable, it doesn't produce. All that is true. It will. It's that the system is built around fragmentation. And as a byproduct, what you're doing may fall between the cracks. So the concept of the book deals with the fact that healing, the process of healing, all of us together in healing, begins when systems are designed around people and not transactions. If you really think about it, the practice of medicine is becoming more and more specific or specialized and more economically driven. So much so that when a patient is in a physician's examination room, often the physician is looking more at the laptop on a movable cart that they move from patient to patient and asking questions and typing away to fulfill their regulatory obligations than actually listening at the patient. And so the patient starts to feel that they're experiencing the doctor, the physician, or the health professional through the back of the laptop as opposed to actually being in conversation with their healer. So the book really strips away the veneer and deals with what fragmentation looks in real life. It's the clinical breakthroughs that stumble at access. What you're doing, those of you who are JP Morgan and thinking about JP Morgan at this time, it's about patients navigating complexity when they're very vulnerable. And it's about clinicians, health professionals, caught between protocol and compassion. The book champions stories over statistics. It's about the human experience that reveals the gaps data alone cannot. It's about how empathy changes how problems are defined and solved, and it's how trust is built through understanding, not explanation. So I do want to share that the book is also structured around real life stories. Real life stories that many of the people who reviewed the book, well, people that many of you may know, the new CEO of the American Medical Association, John White, or Microsoft's champion lead for startups, Sally Ann Frank, people like this who reviewed the book and said this book spoke to them because it really speaks about their experience either as champions of innovation or champions of providing health itself. And that was very gratifying. The book is an opportunity to rethink how we work together. And with that, I want to stop for just a few moments and read just a few paragraphs from my introduction of the book, because you get a flavor that I think all of you can identify with, or I hope you'll identify with some of the realities that we face. And it gives you sort of a flavor of the book, and hopefully will get you rethinking how you work within your enterprise and how your enterprise works with other people in the health ecosystem. Houston, we have a problem. Launched on April 11th, 1970, Apollo 13 was to have been NASA's third lunar landing. 2 days into the mission, an oxygen tank exploded, forcing the crew to abandon their plans to walk on the moon and focus on new goals, survival and return to Earth. The explosion crippled their capsule, but critically, it did not silence radio communication. Because of the open link with Mission Control, the crew was able to access and solve their problems and develop a plan to bring their command module safely home. Were it not for that communication system, astronauts Jim Lovell, Jack Swigert, and Fred Hazy would have tragically perished far from home. Instead, they lived because they were able to talk through their challenges, collaborating with experts at Mission Control. More than the successes of earlier lunar missions, it was the agency's defining moment, an illustration of why the American space program was so great. If NASA had operated like today's U.S. health system, Apollo 13 would have ended in tragedy. The experts on the ground would have been trapped in siloed organizations, unable to share information. Even if they had managed to communicate and find a solution, they would have needed prior authorization from a faceless administrator before acting. By then, the capsule would have burnt up on re-entry. The same maze of complexity that patients struggle to navigate, that crushes the spirits of health professionals, would have doomed the three astronauts. Healthcare, we have a problem. And that's how the book begins. It's a snippet from the introduction, but it really gives us a sense of the reality that health professionals are dealing with. So when I'm dealing with people in the innovation field, where they're developing a new molecule that, as you'll hear in our next session in a few moments, some of the miraculous things that are happening in the field of neurology in very, very, very difficult illnesses. It's not just the quality of the molecule, its science, its regulatory aspects. There's then the payer's financial review, getting it on formulary so doctors can access it fast enough without having to argue about all the things that the patient has failed on in terms of step-through therapy, and then making sure the patient's actual health insurance covers that therapy and whether they can gain access to it at that medical system. All of these things are happening. All of these things are happening at all times. And a lot of people develop things and they're so good and they're so needed, and yet they're so difficult to access, like our friends at in Apollo 13. If they didn't have the ability to make decisions quickly, and all the experts in NASA Mission Control were speaking to each other, communicating with each other, and they were all working from the same tool book and a sense of design plan to make things happen for those three astronauts in space quickly. That's a defining moment. So what often happens is stories really are diminished. The book really talks about stories over statistics. It talks about how the human experience reveals gaps alone that the system is not able to change at this point, but how empathy changes how problems are defined and solved, and how trust is built through understanding and explanation. The book is very different because it doesn't deal with critique. It doesn't deal with blame. It actually deals with the opportunity to change without actually waiting for reform. I know that sounds funny because we're constantly looking to the U.S. government, the federal government or state government, when it deals with aspects of, for instance, Medicare and Medicaid, for them to make changes. The book says, look, that will happen or not happen. Here's what we can do as collective leaders in the system. For instance, if you're an innovator, here's what you can do in order to change the system. If you're in finance, here's what you can do to advance the system. So the book does talk about more inclusive trial design. The book does talk about how communication builds belief, not just compliance, how leadership tone shapes culture and decision-making, how hope drives adherence, trust, and long-term value, how people engage and support ideas more deeply when they feel seen, how empathy is infrastructure, not actually emotional sentiment. The book is a practical call to action. It's about how to identify one reoccurring decision that allows you to influence your outcome and how you can create change when people truly matter first. All of you who are going to JP Morgan or thinking about JP Morgan, regardless of your role, you're a CEO, you're a CFO, you're a business development leader, you're a communications leader, you're responsible for investor relations, you are stewards of trust, not just innovation. The book and your experience, ideally, actually filtered through the book, shows that healing does not mean dismantling the system. It actually means centering the system about why we all exist in this industry in the first place, to make people feel better. Now, if I could deal with behaviors that impede us, I would say look at the tragic murder of healthcare executive Brian Thompson from United Healthcare. Murder is unacceptable for whatever reason. But one would expect that payers would have said, it's not just the murder, it's the societal response to the murder. That the murderer is almost seen as, by some, as a Robin Hood. That people have raised more than $1 million in crowdsourcing for his defense. That's a sign of disconnect between health insurers and the people they seek to serve. And it represents this disconnect, sort of says, we're not aligned with our customer base. And that's why the whole title of the book is Healing the Sick Care System, Why People Matter. We have to center the system and our efforts around why we're doing this. It's to actually champion the cause of people, individuals, and communities. And so the book talks about every aspect of the health ecosystem, our health professionals, our health payers, our government officials, our innovators, of course, patient advocates. Everybody is represented in this book. Stories for all are represented. Some appear more as champions and heroes. Others have work to do. Everybody is needed. Everybody is needed. There is a door opened to all to say, we can make a difference here. We can change. We can do better by starting there. And one vignette I'll say in the book, my daughter, who has a rare disease, features in the book with her permission. And the greatest leap of faith or change in her health started when she met a physician at NYU Langone, Dr. Nisa Goldberg, a cardiologist by training, who was examining all the myriad of symptoms my child had and said, I don't know what you have, but we'll find out. I don't know isn't about lack of knowledge. It's about an abundance of curiosity. Too often, we feel compelled to give answers. We don't need to do that. What we need to do is seek the knowledge and partnership of the pieces of the ecosystem. Back, of course, to Apollo 13 as we close. Why did they survive? Well, all systems were pretty much destroyed, many of them. The heating system, oxygen was running low, fuel was running low, certain systems were offline. The communication system was online. The communication system was online. Communication is part of the care. It's part of the cure. And there's a tendency on the part of companies to keep information or connection close to the vest. You'll see the greatest leaders, champions of success, are people who are effective communicators. That goes down to the granular, to the physician, to the health professional, the nurse or the pharmacist or the administrator or the bench chemist or the CEO of a startup or a multi-billion-dollar company. If we connect, if we communicate, if we collaborate, our system won't necessarily eliminate fragmentation. It will reduce it, speed answers that people are seeking for cures, for help, that demonstrates the value of our industry and its life-sustaining impact on society. Thank you very much for this moment. We'll now continue with another session. I ask if you're interested, visit Amazon, visit Healing the Sick Care System, and of course, I welcome your comments. Thank you.